Hello to all the viewers. Hello, everyone. So, can you please let us know in the chat box if we are audible and visible? Yes. Right. All right. I hope everything is good. And let's actually start this session. Well, the NEET SS 2025 results have been announced. And obviously, mixed responses. Some students, you have got good ranks. You're just waiting to join your super specialty, and you're just awaiting, when is the counseling. Whereas some students have got ranks in the borderline range, and some students, you have not performed to your potential and maybe a bit disappointed. So today's session is mainly for these two category of students, those who have given the exam, maybe rank in the borderline range, or you have not performed to your potential, or maybe you have not prepared for this NEET SS exam, and even for the residents who are preparing the final year or second year residents preparing for the INI exams as well as the NEET SS exams as well. So we would like to address all of your queries. So with me, I've got Dr. Karthik Vijaykumar, who is the endocrinology faculty at DocTutorials. And together, myself and Dr. Karthik, we are going to address the queries that you are having at this stage. So Dr. Karthik, welcome.
Yeah. Good evening, sir. Good evening, sir.
So can you just show the screen?
Yeah, sure, sir.
Right.
Sir, I hope the screen is visible.
Yeah, I think you can make it full screen. Right. So yes, the session essentially is a roadmap to INI SS as well as NEET SS medical group, exams that are coming up. So Dr. Karthik, the next screen.
Yeah.
And I'm sure, all of you are there already in our academic WhatsApp groups. So what you're seeing on screen are the Instagram profiles, the academic Instagram profiles, my profile, Dr. Karthik's profile, as well as the DocTutorials super specialty page. You can stay tuned to these pages as well. And in case those of you who are listening to us, in case you have not joined our academic WhatsApp groups, almost every seriously preparing candidates, they are actually there in our academic WhatsApp groups that we have got. In case you are not there, please message me in Instagram. You can send me a message in Instagram. My Instagram ID, as you can see there, is dr_Rahul_Rajeev. So you can just send me a message in Instagram. I'll be sending you the link to join the academic WhatsApp groups as well. Okay. So that is what I'd like to tell you, and this session will clarify the doubts of all of you at this particular stage that you are in. So Dr. Karthik, in the current scenario, I've told you that NEET SS, after the results, we have got a lot of happy messages, but along with that, there are many students, who are having queries with regards to what they should be doing now. Should they prepare for INI? Should they prepare for NEET? Should they take a leave and then prepare for INI? A lot of doubts are there. So Karthik, what do you have to address at this moment?
Yeah, absolutely, sir. In a very competitive exam where around 10,000 students are giving the paper, so it is like it hardly happens when each and everyone who gives the exam comes out with a satisfactory result. So there will be the top 200, 400 rankers who will be very satisfied with the results, who will be like gripping to join the institute that they wish for. But there will be some borderline rankers. There will be, as sir told, those who have not got the rank up to their potential. So we are mainly trying to address those students who will have certain degree of apprehension, may have certain uncertainty moving forward, whether to wait for the counseling or to appear for the next INI. We have been getting a lot of messages asking for clarifications. So this is what we are going to emphasize. The NEET SS results, which was published last week, is not a closure. Okay, everyone is not totally happy with the result, and some are going for betterment and the prospects for INI. And very important to note that the counseling, you just cannot simply wait for the counseling to be over and then make a decision and proceed to the INI. So counseling takes time, and you have to make a decision at this point of time itself and merely cannot wait till the counseling period is over. And you have already have the provisional date for April session of INI published in the AIMS website, which is April 26th of 2026, around say 3 months from now. To be exact, we have 2 months and 25 days till the next INI April session. So what happens, the most important mistakes many students make is that some of them pause preparation completely. It's been 1 week since the NEET results have been published. So they may still be like in the hangover of the results which have been published, not really into the groove of the next level preparation, or they might be reading something haphazardly without any direction. So here comes the relevance of the session. So we will be guiding you, or will be trying to help you to get the wait period, that is from the time of publication of the result throughout the process of counseling until the next INI, how this wait period can be used productively. And many of you will be at different levels of preparation. We'll be coming to that later on. So based on your current position, how can you align the strategies for the upcoming INA exam? And you have plenty of resources. You might be a subscriber of multiple platforms. You have so much of resources at hand, the notes, the videos, the GTs, the Q banks. So how to make the optimum use of those available resources at your disposal? So I'll just looked at the dates of NEET SS 2024. What was the date of publication of the results to the cessation or the final date of counseling? You can see the NEET SS 2024 result was published in 30th of April 2025. The first round allotment began within a couple of weeks, and by the time the entire process was completed, it has taken around 3 months, from 30th April 2025 to 30th of July 2025. So just imagine, this time the result was published by the last week of January 24th. And if the NB sticks on to a similar timeline, it would take another 3 months. So another 3 months means your INI April session would already be over. So reiterating the fact that you just cannot wait for the counseling process to be over before starting preparation for INI.
So basically, I think Dr. Karthik, you are just trying to tell that there is this phase till INI, which is an opportunity. So there is an opportunity that lies in this phase, and to take a decision on whether to prepare or not is not, something to be taken after the counseling is over. And this especially holds true for the mid rankers and those who are unsure, whether to take a seat or not. So all of those confused lot of students should be utilizing this time, for preparing for the exam, right?
Absolutely, sir.
Yeah, please.
So why do we say that you just cannot follow just one strategy? Because the group that you have at hand is heterogeneous. Some of them may be already having a very good rank, but just for they would be just trying at one more shot because they have nothing to lose. Already have a very safe rank for NEET SS. But if at all they are getting a premier institute like AIMS, PGI, JIPMER or something, they would be happy to take it for an upgradation. But there are some others like who would be like gearing up for just INI alone. They have given the NEET SS, but they strongly wish for a seat in INI. So just merely following one strategy will not suit all the categories. So you have same resources, but all these categories should use these resources differently. And at DocTutorials as a platform, we have been discussing all these months have umpteen number of resources, starting with the long videos, LIT and D. All of you must be already familiar while you were preparing for NEET SS. So in the coming slides and all, we will be telling you how you should balance the use of these resources for optimum results. Yes, now we are gearing up for the INISS exam, which is going to happen 3 months from now. You know, the exam pattern in NEET SS and INISS is grossly different. For NEET SS, you had a very, very broad topic. You have to cover a whole lot of areas ranging from your fundamentals in medicine to environmental medicine, toxicology, and all the core specialties. You need to be a jack of all trades for cracking the medicine exam. But INI is slightly different because it more or less have a predictable pattern. Predictable pattern in the sense I'm not telling about the distribution of the type of questions. It is from where the questions are likely to come. So if you have attended the previous INA preparation like sessions from our DocTutorials faculty, so all of those faculty would be listing say 50 or 60 high-yield areas or high-yield topics from which the questions are more likely to come. We are not telling that this question will come, but from endocrinology, I can surely say that 100% there will be a question from primary aldosteronism evaluation. It could be related to adrenal venous sampling. It would be related to like interpretation of the laboratory and biochemical data, something like that. So those high yield areas you can identify. Okay, so how do you are able to identify? Because we have the previous year questions. In the DocTutorials app itself, we have like last 5 to 6 sessions recall videos available. And if you go through those recall videos, it is very obvious that you will be having a lot of clinical reasoning and long stemmed questions and very little one-liners. So our basic focus will be on option elimination rather than just reading through the question and choosing the correct answer. It
Right.
will be the focus on option elimination. So one major difference between INI and NEET SS exam is that here you have to focus more on the depth than volume. NEET SS paper is voluminous. You have to cover large and broad areas. But here we have limited number of topics, but you have to go into greater depths because sometimes we have seen in one of the previous papers, some of the questions at least could be of a DM exit level difficulty. So you have to have a very deep knowledge on your specialty of choice. Rahul sir, your take on this?
See, I think one very relevant point that you said is regarding the predictable nature of the INISS. So after the NEET SS results were announced, a lot of students have messaged me regarding INISS preparation. And they said, what should I do first? Should I watch the main videos, QRP, LI test and discussion, Harrison tables and flowcharts? What I just told them is that irrespective of your current stage of preparation, whether you are going to write the INI for the first time or you have already given it once, whatever be the stage of preparation, like even if you're naive into the exam preparation, first watch the recall videos. You can watch it at 2x. For example, for neurology, I've done recall videos starting from the year 2021. Now if you go through the recall videos at a 2x speed, just to understand the sort of questions being asked, the topics that are being focused, the type of questions being asked, you will understand the pattern. Now, once you have watched all these recall videos, okay, once, you will get an idea, okay, these are the topics that are frequently being asked. These are the types of questions that are being asked. I feel the serious preparation then starts. Because if you start with this base knowledge of the PYTs, previous year topics, then once you start your preparation, you will be more focused. But otherwise, any super specialty subject is vast by itself. Neuro, endo, rheumat, you've got a lot of portions to cover. But if you don't have this awareness, what is going to happen is that you're going to consume a lot of time, and it's likely to be a directionless preparation. To give a direction to your preparation, to give a focus to your preparation, I think you have to watch the INI recall videos. And I think those recall videos that we have done, I think the sort of discussion we have had not just covers that particular question alone, but all the relevant points that may be asked. Okay, at least the lead points we have actually said, maybe for a future question as well. So INI recall videos are gold. You should be watching them thoroughly. And once you are done with your preparation, or maybe, towards the later part of the preparation, again, come back to this, recall videos. And I've had toppers, last time for the INI topper, Dr. Srihari, he told me that he has watched the INI neurology recall videos 3 times. He has watched the videos 3 times. He has made notes. And he says that he exactly knows from which part of the note, okay, this question, he has jotted down. So it's not about watching those videos. He has written all the notes from the recall videos. So that's what I want to tell you about the importance of understanding the INISS, the game of INISS. If you understand, things are going to be a lot easier. Right.
Absolutely. So the student grouping post NEET SS. So we have, for the sake of discussion, we have categorized from our own perspective. There would be 3 or 4 categories of students who will be like anticipating for the counseling, who would be like eagerly waiting for the next INISS, etc. So one group would be the freshers who had just passed out last year, who had given their first NEET SS maybe without a great deal of preparation, may not have got a satisfactory rank or a borderline rank, and they will definitely be giving an INISS. But remember, they may not have an in-depth reading of their specialty of choice before this, because right after they have passed out, they have been preparing for the NEET SS. So the first real INI exam takers, those are the freshers. Second, those would be having a borderline NEET SS rank, that they have not yet decided whether to join for NEET SS or not, because they will not be, probably they may not be getting their specialty of their choice. If at all, they'll be getting the specialty, but their preferred institutes, they are not hopping to get. So them, I've categorized them into the borderline NEET SS rank. Third, would those who are adamant on getting into a premier central institute. Those, they may have already given the INI last year. They may have also given the NEET SS, but their first preference is always INI. Four, those who have already got a very good rank for NEET SS, maybe within 100 or within 300, 400, they'll be getting their desired specialty and probably some of the desired institutes as well. But in some likelihood, they may give a go at INISS April session. Why? Because they would also like to have a seat at the AIMS, PGIF, JIPMER, if at all it is possible. But in all likelihood, they are going to join the NEET SS, but they may, in a relaxed fashion, without undue pressure, they may give the exam for INI. So I'll be discussing the strategies that we feel are right for each of these following groups. So irrespective of which group do you fall to, as Rahul sir said, there are some must do as you are preparing for INI. One, yes, Rahul sir has already emphasized the importance of doing a previous year recall. It will help you identify the high yield areas which are being repeated time and again. So you have to identify the frequently tested areas. And very important, again, sir has mentioned, to have a set of notes on your own. This is of special importance to those who are preparing for INI for the first time. You may not have a dedicated notes which are prepared from the long videos. So I can vouch you that if for any specialty, not only for endocrine or neurology we are speaking about, for any specialty that you are appearing for, if you are able to cover the long videos of the entire topics under that specialty, prepare notes out of it with dedication, and do the corresponding Q bank, GT, etc., and to add on that supplementary points to the notes itself, then in most cases that could even replace the reading of your standard textbook, because you have around 2.5 months at your disposal. Those who have not read the specialty textbook may not be having the enough time for that. So one strategy that will serve you well is to supplement the notes prepared from long videos with the additional points that you will be constantly getting from solving the Q bank, from the GTs, the Harrison videos, and from the Elite T&D discussion videos, etc. So very important to maintain the error logbook, because what is going to serve you well in the INI is not the information from the questions that you get correct, but from the questions that you tend to get wrong during your MCQ practice. So you have to pay special attention to the questions and areas where you are consistently getting the questions wrong and reinforce them. Maintain an error logbook where you note down the mistakes that you have made and why did you make the mistake and how should I correct that. So those error logbook you should review repeatedly.
I
And
think
of
that's a
course,
very, very relevant point as well, because I also strongly would vouch for the error logbook, because Karthik, often students message, sir, I'm stuck in this DT score, I'm not improving further. So you have to maintain an error logbook. And see, when we say error logbook, suppose you have got a question wrong, say for neurology, you have got a question wrong with regards to side effects of some disease modifying therapy in multiple sclerosis. So maybe it is regarding teriflunomide. So if you have got that question wrong, not just teriflunomide, all the other disease modifying therapies, you have to just look at the side effects as well, because that is how you will cover the topic per se and not the question. So when Karthik sir says maintain an error logbook, he also is trying to emphasize that that particular area is important. That is how you can improve upon your GT scores as well. Otherwise, your GT scores might be stuck. So there should be a conscious effort from your side, to rectify whatever mistakes that you have made. Otherwise, what will happen is that many students try to make their stronger areas even stronger without rectifying the mistakes. Right.
absolutely, sir. And nothing can replace the regular MCQ practice. And this point is what sir was emphasizing with analysis. It's not about just guessing the answer correct. You might have got the answer and by actually because the options may be too like easy or too distant to one another. So even if you didn't know the answer, because you were able to exclude, you were able to get the answer. But that may not be the case for actual exam. So whenever you are going through a question which you didn't know beforehand, even if you get the question correct, try to analyze it and try to get maximum points revolving that area, because that is one weak area for you. As Rahul sir told, try to assimilate maximum information in and around that topic so that even if a slightly different question is going to come for your exam, you will be able to crack that. And very, very important, doing grant test. Because doing just an MCQ practice from QBank is very comfortable. You are not under any undue pressure. But only if you attend the grant test, either in real time or there are, for endocrinology itself, there are 30 to 35 grant tests available from the previous sessions as well. So appearing the grant test in a time-bound manner will give you a real exam-like scenario. Many students say that, sir, like that is what which helped them the most. They might have all the information on the back of their mind, but only when they are applying it on an exam-like scenario, then only you will be able to identify, okay, I'm taking more time, or I'm answering the questions too quickly. Maybe I can give a bit more time. I've had 10 minutes left before I've gone through all the questions. So such modifications and rectifications can be made only if you attend grant test properly in a time-bound manner. Yeah. So with this, we'll be moving on to the strategies category wise. First, about the freshers. So remember, these are the ones who had their first NEET SS attempt and who hadn't have a previous CDS INI preparation or attempt. So for them, the focus would be on getting the concepts clear and not about like going very like in a pacey manner, trying to finish the long videos, everything in a 2 weeks manner or something. They need to have conceptual clarity at first. So for them, preparing the notes from long videos are the primary aim. So it has to be your primary learning source because you just cannot read the standard textbook cover to cover. So you should spend maximum amount of time preparing the notes, at least in the first month. That means in the month of February. You must have prepared the entire notes by the end of February. And side by side, like if you are spending, so if you're reading 10 hours a day, 6 hours for the notes preparation, and maybe 2 or 3 hours you can take for solving the Q bank. But here it has to be topic wise, because you are covering the notes or the videos topic wise. You should simultaneously do the Q bank topic wise and then add on to the extra points that you are getting to the notes. And grant test, you may not attempt any grant test in the month of February, but once you are done with the topics, the first round of notes preparation is done, then it is at that time that you should start giving the grant test to see where you stand and how you can improve with the strategies Rahul sir has already mentioned. So group A, it's pretty clear. You need to be thorough with the concepts, which is the backbone of INI preparation. Prepare the notes, reinforce the information by periodic assessment using topic-wise questions in Q banks. And once the notes preparation is done, you go for the grant test. But again, we are giving you a caveat that this is how we feel the strategy should be. But again, each student is different. One may have their strengths, their weakness. They may feel that this strategy may not be best suited for them. Of course, it is subject to change, but this is how a standard preparation should go like. Rahul sir, any inputs from your side?
See, just one point I want to tell you is there will be many freshers doubting their capability of cracking INI in first attempt. Especially for those who have just passed out, please understand that you've got good base knowledge, and for you, aggressive Q bank practice. I think that is what that can lift your game now to the MCQ mode. So you need to shift quickly to that MCQ mode, and that is what is important. Do not underestimate your capability of cracking INI in first attempt. But the thing is, get into MCQ mode as soon as possible. Okay, right.
Yeah, I've been getting a few questions from the like endo aspirants. For endo aspirants, I can tell you with utmost confidence that you should start with the long videos, and simultaneously after like finishing a particular topic, say adrenal, try to solve all the questions from QBank. Because if you go through the previous year topper interviews as well, so all of them are echoing the same fact that if you have prepared the notes entirely from the long videos and you have supplemented the points from the QBank, that is pretty much enough. It's been the case for at least the last 5 to 6 INI. So you'll be able to score more than 90% from the endo part if you are thorough with the questions. Of course, you may have to have a bit of luck. There will be confusing options, but I can guarantee you the questions is 100% going to come from the node splits QBank. Now, for the borderline NEET SS rank, this is where it becomes tricky, because the students, they really want to like anticipate and expect a good institute allotment in the counseling process, but simultaneously they will be for taking a chance with the INISS as well. So this is where their focus should be to get INI ready while counseling runs. You should not be too much phased about the counseling. So counseling should run side by side. You should already have a priority list of institutes or the choices where you have to fill when the counseling window opens. But apart from say 30 minutes maximum per day for these counseling related activities, other than that, you should get INI ready. For them,
And Karthik,
yeah.
what I just tell students as well is, even if you want to prepare for INI, many students say that, sir, all the time I prepare, I'm thinking about counseling, which college to give. So what I tell students is like, look, don't mix both of these. What I would suggest to you is, suppose you're studying from morning till say 10 p.m. You focus only on your INI preparation till then. Then from 10 p.m. till 11 or 11:30, you just think about counseling alone. But if you mix it up, like you're preparing, then you're calling some friend, asking about a particular college, and you mix your preparation with this, you will not be able to focus. And this is, look, a highly competitive exam. You're appearing for a central institute exam. And if you want to crack that, it has to be a sharp and focused preparation. So I would say that try to dissociate yourself from the counseling the time you are focusing on exam preparation. But outside that window, you just focus on the counseling alone. You give a separate window. You want to call somebody and ask, okay, regarding some college selection, please do that. Right.
So for them, they may have already the notes being prepared. So they have to give equal weightage to the Q bank solving as well. So get into the MCQ practice mode because their focus may not be that great. So going through the notes, they may not be totally focused. So for them, for getting into the groove, at least in the initial phase, solving a lot of MCQs will help them rile up the preparation in the earlier phases.
And
And
Karthik, the best way to get into MCQ mode is to give a grand test upfront,
yeah,
a blind GT right now. It is just to understand where you are standing. Whatever category you belong to, just give a baseline GT. Then you will know what distance you have to travel. Okay. So I would always suggest to all candidates, give a baseline GT irrespective of your level of preparation to understand what is your starting point.
absolutely, sir. And like after getting an idea, where do we stand with enhancement of your preparation? You can give periodic grand tests, say weekly or every 10 days, and you yourself will feel more confident when you are getting more questions correct. And that itself reflects because many students, even before the exam, messages that, sir, I'll consistently getting a top 15 rank in the INISS. So they are very confident approaching the exam as well. So the exam day anxiety itself will come down if you are able to score consistently well on the grant test. So that is why you should not leave grant test till the very end. You should give it some time because if at all, like you are while doing a routine MCQ practice, you will be able to solve most of the questions, but it comes into the scenario of a grand test because of the time pressure or anything, you are getting many questions wrong. So you have to identify that problem early, then only you will get enough time to rectify that. Now, the Group C are the INI repeaters one who seriously preparing for INI might have already given the November session as well. So for them, they already have the content in their hand, already have read the notes, already have a ready-made notes. They might have gone through the important aspects in the specialty textbook as well. So for them, they need to be very accurate and correct as far as their knowledge is concerned. They might have lost a seat last session because of a few wrong questions. So they're focused to get the maximum number of questions correct. So they have to have a revision of the notes, but again, it should be targeted revision of their weaker areas from the areas they found it difficult during the previous preparation and the areas where they got the questions wrong from the previous sessions. So very important again, doing QBank. So QBank takes a front seat in students who are INI repeaters and very important grant test. So one of the students who was a repeater for the November INI session, she has told me that, sir, there were 34 grant tests and she did every 34 of that grant test. So just imagine how many questions you are going to solve in a time-bound manner when you are giving 34 grant tests. When you
Karthik, I
are,
was also just about to say
yeah,
the same point because even when I took the interview, also candidates said every GT in the app, new, old, everything that candidate has given. And also last time the rank one said QBank was done and QBank was revised 3 times. The person has gone through the QBank 3 times so that each and every question, the candidate was thorough because whatever mistakes were made in the first round, the candidate made sure that, okay, this is the like proper way to think. And, this is where, I've got some weakness. I've just got to rectify, go back to my content. Yes, rectify it and then move forward. Right.
absolutely, absolutely, sir. And again, while solving the Q bank, I'm again repeating a fact that option analysis is very important. One of the options may not be familiar to you. So just go through that. What is it? Why is it not the answer? So
And
not
Karthik, I've seen,
just
even for INI, the next year question coming from the options of, like one of the questions. Like I've seen like that as well. I'm sure, in your endo as well, you might have come across such questions. So it's very important to screen through the options as well, and for the recall videos as well, and study that particular topic also.
And that is one thing that the recall videos of DocTutorials are unique. Like the students are consistently giving us the feedback that even the options that is discussed for the recall videos are actually the exact ones which are being asked in the exam. So we are not just giving the crux of the question and telling the answer. So we are actually giving you the options as well. It is primarily for this purpose alone, because the options could come as the potential questions for the next session. Yeah, so Group D, the likely NEET SS joiners, more on the safer side. They have already had made up their mind, probably choosing one of the favored institutes, but they may also give a go for the April INI. So their focus is not to lose the total touch and stay academically warm. So they have to have a revision of the notes which they are already familiar with. And QBank, again, they might have already bookmarked the questions, the difficult ones. So the primary aim is not to solve maximum number of questions, but to identify the questions that they had gotten wrong previously and reinforcing the concept. So grant test, again, as Sir told, more the merrier. If you give more grant test, the better. But they may be less intensive on the grant test, not to do grant test on every weekly basis, probably 3 or 4 grant tests, just to make sure that they are remaining academically warm and are staying on the group. Yeah. So the final piece of advice from my side, I'll be adding it initially. Again, just summarizing whatever we have already discussed. Do not wait for counseling clarity to start studying for INI. And there is no need to change resources now. Because, see, I would say the medicine questions, even though it is 25 to 30 questions out of the 80 in INI, that is of equal importance, because most of the students appearing for that respective specialty INI would be well versed with the subject and would be scoring a very high marks. But the medicine can often be rank deciding. But the good thing is that you already have a momentum while preparing for the NEET SS. You are slightly fresh from all the exhaustive reading that you have done for NEET SS, and you have your notes. So that makes the thing a little easier. So don't let that momentum go out of you. So brush through the medicine part as well, not to devote the entire time that you have each day for the specialty preparation alone. You should not let that memory of your medicine revision go away. Brush through that so that that 25 to 30 questions is also being taken care of. So do not count the number of MCQs. So it is about how well you are analyzing a question and how many more points and concepts that you are learning each day, and not just about just looking at the option, guessing an answer and getting a question correct is not enough. Number of concepts fixed is more important than counting the number of MCQs. So error notebook, the point we have already discussed, and you have to revise the wrongs more than rights. Again, very important. So my one piece of advice would be to use this waiting period to prepare wisely. So whichever door opens, so you may be unexpectedly getting a good seat for in a desired institute for your specialty of choice in NEET SS itself. But you just cannot take that risk and merely wait and not to study for the INI. Or your door or window could be opening when you have a good day at the INI exam, where you will get a far better result than what you have got for the NEET SS. So whichever door opens in front of you, you have to walk in confident and you have to be prepared in both ways. Rahul sir, your takes?
Yeah, absolutely. That's what I just want to tell all the students also. And one question in the comment section is to about general medicine preparation. So how to prepare for general medicine part. So I've got 3 valuable resources for you. Number one, in the DocTutorials app itself, the INI medicine part topics, that alone we have done a separate discussion. So you can just go through that. The INI medicine previous year topic based discussion videos are there. That is going to be one resource. Number two, the QRP videos, especially in the NEET SS medical group, we have got the QRP videos. So the QRP videos for NEET SS would also suffice for the INI medicine preparation, provided the third resource, that is Harrison-based QBank of DocTutorials. If you're doing that thoroughly, this combo is enough. That is, I'm repeating again, for the INI medicine part, if your base knowledge is decent. Otherwise, you'll have to go for the main videos, but otherwise, the QRP videos, along with which you can go for aggressive solving of the Harrison-based QBank. That is what we would like to tell you. Okay. And for the INI aspirants, I just want to tell you that sometimes in life, certain failures can be a blessing in disguise. Who knows? In a couple of months, you're going to get INI seat, and you're going to study in a central institute. And that time, retrospectively looking back, you might think, had I got a great rank in NEET SS, maybe I would not have landed up in INI. So certain failures are like that, and we have seen many students over the last several years as well. So that is what I want to tell you. And Karthik, this is the last slide, right?
Yes, sir. Yes, sir.
Another thing I want to tell you is for the NEET SS aspirants. So those who are preparing for NEET SS, first of all, let me tell you something. Look, the date of NEET SS is still not out. So what I would suggest to you is the only exam that we know, okay, that is going to happen on a date like INI, we have at least got a tentative date. So I would suggest all of you to give INI, whether or not you are targeting INI, because if you target INI and learn, even if you're not realistically, going for INI, but at least you have got a target and you will finish the topics and you will do revision also with aggressive solving of the grand test. Now, this will give you a necessary momentum, even if you don't crack INI, very important. Even if you don't crack INI, beyond INI, that momentum you would have already gained. But if you're slow to start and you're waiting for the ideal time, like, maybe let the date for NEET SS be announced and then I start my preparation, mind you, you'll be very late. You'll be very late, and that is going to be a big mistake. This is what we want to tell all NEET SS aspirants. This phase till INI, you also have to give your best effort. Okay. And in DocTutorials also, we'll be soon coming up with, the mini test, the LI test and discussions, which have helped all your seniors as well. We are coming with that very soon. But suppose if I have a candidate listening to me, sir, I'm not going to write INI. You've told about, getting momentum, but, I don't like INI. I don't want to write INI. Maybe, you don't like Delhi climate, so you don't want to go to AIMS Delhi, or, you don't want to go to NIMHANS because of some language issue. Whatever reason you cite, okay, then what you can probably do is, get a momentum. At least, the mini test of DocTutorials will be starting. So you can write those mini tests. You can plan your schedule accordingly. But I'll tell you one thing, why most students prefer using DocTutorials for NEET SS preparation is that rather than, a set of resources that we provide, there is a direction also that we provide. And that is why most of the seriously preparing candidates follow the DocTutorials app, because in the form of mini test, LI test and discussion, there is always a direction, and that is what is required. Because see, at this age of yours, I can understand that the exam passion, or the passion for giving the exam, or the student attitude, you had studying for 14 hours or so, or 12 hours or so during your NEET PG preparation days. But now you might think that even 5 hours is like ages. You're finding it tough. But even if it is 5 hours, you start. That's what I want to tell you. If you tell, sir, I'm working, I'm only able to adjust 2 hours, but at least study 2 hours. So don't break the momentum. That's what I want to tell you. It should not be pause. Remember Dr. Karthik's slide. Many people take a pause, and this pause is actually going to be dangerous. You have to keep the ball rolling. You have to actually maintain the momentum. That is what, we want to tell each one of you. And for the NEET SS medical group, as I said, my suggestion is you have to give INI. And then after that, you continue with the LI test and discussion according to that schedule is what I would suggest. Okay, right. So, I can see one candidate saying, provide a brief plan for NEET SS at least. That's what I'm telling you. Very soon, you will get the schedule of the mini test in DocTutorials app. Okay. So the entire schedule, you'll be getting it. once the mini test schedule is rolled out, then what you have to do is you plan covering the lectures according to the mini test schedule, right? And once one round of mini test schedule is done with, we'll start the LI test and discussion. So then you come for the second round of preparation with the LI test and discussion. So in LI test and discussion also, we'll be having a structured program. We will be given dates, you'll be given portions, and you have to prepare accordingly. This is what you have to do. Don't worry about it. We are going to give a structured planner. You can ask your seniors as well. When we announce the mini test, right from the first test till the last test, the exact schedule will be given to you, and you just follow that schedule. We have had toppers, who were saying that we have religiously followed the mini test schedule. You can just look at the interviews. Most of them, 95 to 98% of the seriously preparing candidates will follow all these mini test and LI test and discussion schedule as well. Okay. So, so I think procrastinator, that's what I just want to, I'm telling, I'm sure that is not your name, but first of all, you should not procrastinate. That's what I want to tell you. And don't worry regarding that. The schedule will be rolled out, and you just blindly follow that schedule. Okay, right. So next is, sir, please guide for not so good rankers. I think that we have started. No, standard textbooks or videos. See, I'll tell you, like if you want to start with neurology or endocrinology, rather than starting with a textbook upfront, you read. I mean, you watch the lectures, and if at all, suppose you are preparing for INI Endo, rather than covering Williams. Page by page. First, you watch Dr. Karthik's videos, and then if you have got time, you can retrospectively go back to Williams. That's what you can do. Rather than, first reading the textbook and trying to develop, your own understanding, that might take more time. But once you have listened to Dr. Karthik's lectures, and then retrospectively, if you can just go through it, that will be good. But let me tell you, since I very well know the effort that has been taken by each one of us faculties, if you cover the lectures with LI test and discussion, QRP, I don't think there is anything left. So one thing you have to remember about the resources in DocTutorials is, if some content you feel is missing in the main video, it will be there either in the QRP or LI test and discussion. Suppose, you feel, okay, sir, you have not discussed this particular topic. You go through the entire content, because we know, like, okay, this topic we have not, taken in the regular lectures because, it is relatively less important, but we'll cover it indirectly in the form of a question. So to use these resources are very, very important is what I would, tell you. Okay. Harini is asking about infectious diseases. Yes, we'll be having, a particular set of videos for infectious diseases. We'll keep you updated also regarding that in the group. That's what I want all my students to be in the groups. As I have just showed you in the beginning part of the video, the Instagram ID, you can just personally message me as well. Okay, right. So a candidate is asking how to approach mini test. Should we watch videos before mini test and finish? Exactly. So before the, if you have got a schedule like mini test, seizures and epilepsy, peripheral neuropathy, multiple sclerosis, suppose these are the topics for the mini test, first mini test. Then what you have to do is, before that particular mini test, try to watch the videos and then practice QBank and then attend the mini test. Okay. So mini test is a timetable. So it is a timetable. It is a timetable that is being given to give you a direction in your preparation. Okay. Right. Karthik, any other question you want to address in that?
I think most of the others we have already discussed in the discussion itself. Yeah.
So I think, that's it. Shall we close?
Yes, sir. I think we have already crossed that 45 minutes mark.
Yeah. I think, we are always available. Okay. Though we are closing the session, we are always available in the groups. And, even if you're watching this session later, please make sure that you are in the WhatsApp groups and all of us will be, happy to guide you for the exam preparation further as well. So thank you so much everyone for joining. And from the entire team of DocTutorials, we wish that in the coming, the INI SS as well as NEET SS, you're going to shine very well. Thank you so much everyone for joining. Thank you, Doctor.